Hi, my name is Cassandra Henderson, and I'm going to be doing an educational lecture about diabetes mellitus type 2. The target audience is going to be second semester sophomore level nursing students, students actively enrolled in a bachelor's degree program, and students that have completed all previous semester coursework. The objectives: by the end of the learning lecture, the student will be able to describe at least 3 signs and symptoms of diabetes, distinguish between types of pancreatic islet cells and the hormones they produce, explain 3 effects of chronic hyperglycemia on the body, and reflect upon nursing education opportunities for patients. The evaluation criteria is going to be a 3-question quiz at the end of the lecture. It'll have multiple choice, true-false type questions, and the purpose is going to be to assess if learning objectives have been met. So the normal physiology of the pancreas, it's normally composed mainly of 2 types of tissues, the Acini cells and the pancreatic islets. The Acini cells aren't really going to be the focus of this lecture. They're not the source of dysfunction that causes diabetes. It's the pancreatic islet cells that we're going to focus on. And there are 3 major types of hormone-secreting cells: the alpha cells, the beta cells, and the delta cells. The alpha cells secrete glucagon between meals when blood glucose levels drop below 100. They can also help in regulating insulin levels and insulin release, and stimulates glucogenolysis and gluconeogenesis. The beta cells secrete insulin during and after meals to facilitate the movement of glucose into cells. They also secrete amylin, which aids in keeping blood glucose levels stable, slows down stomach emptying, and stimulates feelings of fullness. The 3rd type of cell is delta cells. They secrete somatostatin to limit stomach acid secretions, and is secreted about the same time as insulin. It can affect the release of both insulin and glucagon. So in general, these hormones are secreted in relation to eating and fasting, in response to nutrient levels in the blood, and to regulate the metabolism of fats, carbohydrates, and proteins. These hormones keep blood glucose levels within normal limits. The pathophysiology of diabetes type 2. There's 2 main pathological processes happening. You can have insulin resistance, where basically your body tissues become less sensitive to insulin. This can even occur when there are normal amounts of insulin in the blood. The tissues are just not able to use it effectively. The 2nd type of dysfunction would be beta cell dysfunction. When you have chronically lots of glucose in your bloodstream, the beta cells secrete lots and lots of insulin to help keep up with the amount that's in the blood. And after a while, they become exhausted, they get tired, and this can lead to deficient insulin levels. Insulin resistance and beta cell dysfunction can result in chronic hyperglycemia. The effects of chronic hyperglycemia on the body can be cell dehydration. Elevated blood glucose levels can increase the osmotic pressure of extracellular fluid. The body tries to compensate by pulling water out of the cells. Further compensation is attempted when excessive glucose is excreted in the urine. This causes less water to be absorbed by the renal tubules. When too much water is excreted, it can further the dehydration. Another one of the effects on the body is tissue injury. And the exact mechanism by which the tissue injury happens is not well understood, but it's thought that the proteins of endothelial and vascular smooth muscle tissues are damaged. Structural changes in the blood vessels throughout the body can also occur, which can reduce blood flow to tissues. Another reason, or another effect, can be increased use of fats and metabolic acidosis. Because the cells are not able to use glucose for energy, the body attempts to find another source. The fats are broken down and keto acids are released. Excessive keto acids combined with dehydration from polyuria can result in severe acidosis. And the last effect on the body of chronic hyperglycemia can be depletion of the body's proteins. Like fats, proteins are also broken down at a more rapid rate as a compensatory method to be utilized as energy for the cells. This can cause rapid weight loss and polyphagia. So for a diagnosis of diabetes type 2, you need to have an elevation of 1 or more of the following. You can have an elevated hemoglobin A1C of greater than or equal to 6.5%. The hemoglobin A1C is kind of an estimate of the blood glucose levels for the past 3 months. Another test is the abnormal glucose tolerance test. You have glucose greater than or equal to 200 milligrams per deciliter 2 hours after a carbohydrate load. You can have elevated fasting glucose greater than or equal to 126 on more than one occasion. You could also have elevated random glucose levels greater than or equal to 200, accompanied by the classic signs and symptoms of diabetes, and we'll talk about those in just a minute. The leading causes of diabetes. Obesity is the number one cause, but the exact reason for that's not well understood. Some studies indicate that the liver, skeletal muscles, and adipose tissues of obese patients have fewer insulin receptors. And some studies indicate that it's possible that excessive lipid accumulation is toxic and creates abnormalities in insulin signaling pathways. There are some other causes of insulin resistance. You have polycystic ovarian syndrome, pregnancy, excessive growth hormone, and excessive glucocorticoids. So the signs and symptoms of diabetes, there's three main ones, the three Ps. With polyuria, you have excessive urination due to hyperglycemia. When blood glucose levels are high, the kidneys try to reduce level by urinating. A reduction in the blood glucose does not happen effectively, so the kidneys continue to try to remove it, causing frequent urination. Polydipsia is excessive thirst. It's caused by high blood glucose levels, increasing the concentration and osmolality of the blood. Excessive thirst can also be caused by dehydration due to excessive urination. And then the last P is polyphagia, excessive hunger, which is caused because sufficient glucose is not able to enter the cells, and this essentially causes cell starvation. A few other symptoms you can be on the lookout for are poor wound healing, excessive fatigue, rapid and unexplained weight loss, and numbness or tingling in the hands or feet. You can have several complications because of diabetes. It's the 7th leading cause of disability worldwide, and it's the 7th leading cause of death in the United States. It's the leading cause of end-stage renal disease, lower limb amputation, and retinopathy. And the damage can be microvascular, which could include neuropathy, nephropathy, and retinopathy, or the damage could be macrovascular, which would be coronary artery disease, cerebrovascular disease, and peripheral vascular disease. Nearly half of those diagnosed with the disease will eventually die of cardiovascular complications, such as a myocardial infarction. Diabetics are 4 times more likely to die of a cardiovascular event than non-diabetics. So the treatment of type 2 diabetes would be number 1, weight loss, because obesity is the number 1 risk factor. Weight loss through diet modification and addition of exercise is extremely important and can even reverse insulin resistance. Probably going to need to monitor blood glucose. That can be between 1 and 4 times a day. Oral medications are commonly prescribed to reduce the amount of glucose produced by the liver, or increase the body's sensitivity to insulin, or stimulate the pancreas to produce more insulin. There's also subcutaneous insulin you can be prescribed. Some are short-acting, some are long-acting, and some are a combination of both. So quiz question number 1. What are the 3 Ps of diabetes mellitus type 2? So the answer would be polyuria. A, polyuria, polyphagia, and polydipsia. Polyhydramnios and polyalgia are not associated with diabetes type 2. Quiz question number 2. True or false? Alpha cells secrete insulin during and after meals to facilitate the movement of glucose into cells. So the answer to that one is false. The beta cells secrete insulin. The alpha cells secrete glucagon between meals when blood glucose levels drop below 100. Quiz question number 3. You have a patient that has received a new diagnosis of diabetes type 2 and states, I don't understand how I could have caught diabetes. I don't eat very much sugar. A valid response by the nurse could be, and the answer to that one is B. Being overweight can increase your risk of developing diabetes. Let's discuss ways to reduce your weight through diet and exercise. So that is the end of my lecture. Here are some references, and thank you for watching.